Boom.
Boom, we're live?
You're live. Well,
It's officially live.
I cannot believe these ladies are here. This shit.
Neil, welcome back to show number. Yeah, welcome back. We're back to another show. Show number 590.
92-ish.
Wow. And a big show tonight. We have back for her third time, I think.
Right.
Dr. Gail Newel, who is our number one doc in the county, I guess would be your title, right? Is
Santa
that
Cruz County Health
Officer?
Health officer.
Yes,
Mm-hmm.
number one. Do you
Yes.
you run the show here?
Well, I'm the COVID queen.
The COVID queen.
Yeah.
Which we're not, this isn't really a COVID show because we've talked COVID till we've been blue in
So
the face.
tired of COVID.
Yeah, so we'll
Yeah.
try not to be too COVID specific tonight. But tonight you did bring your lovely wife.
Yes, I
Kelli
did.
is here.
Well, that was the demand.
Well, exactly. Because
Yes.
and we got to get to the real story. Kelly's going to break
Yeah.
the ice and
Yeah,
we're going to get
kinda
this
done
thing
with
rolling.
that. Gail's been on the show a couple of times. We're done with her kind of thing. Like,
Mic drop. Yeah.
And we do know, Neil, spouses.
We've been on the show 2 seconds. Mic drop.
Well, that was a great show. Gail, thanks for coming by.
Mic drop.
COVID queen signing out.
The wives and the spouses always get us the best information. So, Kelly,
Yeah.
let's just cut to the chase.
Kelly's taking
Right.
clothes off.
Has she been a total bitch during this whole COVID thing? I mean,
Yes. Yes. 24/7.
24/7, a pain in the ass.
Yeah, but you know, when you know your wife really well, you know what to not say or do. And
Which
there's
is?
like,
First-
don't
first thing you
say
would
a thing, and don't do anything but surface, right? So, quiet, eggshells. You know, we've been married for 21
That's remarkable.
ish years, and I know that she's going to be home late. I know that she's not going to be able to do anything but answer phone calls and sit on her computer, and I just take care of stuff and stay out of the way.
You just tiptoe around
Tiptoe around.
and keep the waters calm.
Keep the try not to make the waters any more agitated than they already are.
Well, and you're a surgeon, a professional in your own right with stress and job issues. How does she, during this couple of years, does she not want to hear about your problems? Because she's like, you don't even know.
Not really.
I'm
No,
dealing-
not really.
I'm dealing
She,
with poison oak.
I mean, we're dealing with. I do have a work wife, and I reached out to her and I said, "Babe, you're going to be the total package right now because when I go home, I have to serve the Lord and Savior of our community." And everybody at work has been very supportive of me. And, of course, Gail's supportive of me. She asked me how my day was, and I say, it was great. It was great. It was awesome. I had a wonderful day. Was it stressful? No. My day was fine. Everything was great.
Even on terrible days, that's your answer.
There's no terrible days. I love my job.
I bet you
Right.
do. I know. We're just discussing it with you. I can tell you do.
Well, and the other thing is that this stress, I'm an obstetrician gynecologist, so you can imagine that if you were pregnant and there was a pandemic, it'd be a little stressful. So
Heck yeah.
keeping everybody calm, keeping everybody calm at home, keeping everybody calm at work, it was a little stressful, but, it's a privileged place to be as a physician. And if you can't rise to the occasion at home or at work, then you really shouldn't be doing your job.
Has there been a baby boom since COVID?
Well, I just read just today, that there's been an increased demand for pregnancy tests. So I don't think there was a baby boom during COVID, and they call those babies
Coronials.
coronials.
Oh,
Yeah,
that's a good name. I like it.
Coronials.
Coronials.
All the
boy.
babies that were born during the pandemic are coronials. And I think everything was status quo, but I think that we might see an uptick now because people kind of said, whoa, I'm not going to do it yet. But now they're like, damn it, let's do it now.
And also they're saying that coronials have superpowers. Coronial babies have superpowers, like they walk early, they lift their head early, they talk early.
Yeah.
That's why.
Well,
They've had to be extra resilient, I guess.
Well, I think they've had moms at home, dads at home. They've probably had increased bonding. I saw far fewer breastfeeding problems during the pandemic because moms were at home. They didn't have the stress of going back to work. They were able to. They didn't have all the friends and neighbors coming over and bugging them, and they didn't have to pump, and they were able to
Right.
bond better. I think.
It'll be interesting, I guess, social experiment down the road when these kids are like, I guess, by teenager age, and see how they develop.
Yeah,
the-
babies.
yeah, 'cause of
babies
that early
probably
bonding.
benefited from it. I don't know how teenagers did in the home.
We had a Pastor Renee Schlepper, you know Pastor Renee?
Yeah.
On the show a couple weeks ago, and I think maybe you asked him, or I asked him, would you bring a child into today's world? Because of all what's going on, and what did he say? What do you remember what he said? He said absolutely.
Yeah, yeah. Well, he has the most positive outlook. You know, even
Any
you know,
person ever.
yeah,
Yeah.
it's really amazing. So
Because
his,
of-
yeah,
Because of love and
Right.
You have the love of the family. I'm looking for it. You got grandkids. I'm looking for the grandkid. Sorry, Quinn, but
well, and it's been tough on grandkids because we couldn't travel. You know, my grandkid lives a state away, and so it was a little tough in that aspect. But I like what you're saying about the bonding. I didn't really think about that much, but it is true. The parents stayed at home and they had time. I'm sure not as many babies were in daycare.
Right, and you think about what happened before the pandemic. You know, the baby comes home and everybody wants to come over, and that's really stressful on a young or an older mom to have to get ready and present themselves. And there's also a lot of judgment that goes with that. You know, the friend comes over and says, "Don't hold the baby like that. Hold the baby like this," and not having any of that kind of input, I think, has been really helpful for new moms.
Where did you guys meet?
We met the first day of Kelly's internship.
Wow.
I was actually her teacher for a little while.
oh,
in
here we go.
residency.
Stole the student.
Yeah.
That was in the lovely Fresno, California.
Yeah.
Yep.
Okay.
Valley Medical Center, which we like to call Valley Miracle Center.
Mm-hmm.
It's now closed.
Oh.
Earthquake not safe, so the building got shut down. But yeah, we were friends for 10 years before we became more.
Okay.
So what did you do? How did you do the introduction?
Well, I was the chief resident, and I had to go pick out, like a ball team, my first group of labor and delivery workers. And so I had to go down into this big room and like choosing a ball team, picking out who I wanted to come catch babies the first month of internship. And Kelly was one of my picks.
She raised her hand.
I think I was the first pick.
Yeah, I'm sure you were the
I
first
think I was
pick.
the first pick.
Her reputation preceded her.
Reputation?
Yeah.
What kind of reputation?
Oh,
that.
we have a mutual friend, my
Yeah.
best friend from medical school, who he was in family medicine where she started, and he interviewed and helped recruit her to Fresno, and he said, "You're gonna just love Kelli Beingesser. She is so funny." So and a good doctor.
And who asked each other out first?
You're going to have to take the truth on this one.
We've heard the truth about the last
Yeah.
show. We're
Okay.
talking to you.
I am a devout lesbian, right?
Right.
I want to walk into a room and people not to say, "I wonder if she's a lesbian." No, they're like, you got to know. That's how it is. So I'm a devout lesbian. And Gail is married with a child. Well,
3
children.
You got 3 kids?
Yeah.
Do we know that, TC?
That's news. It's breaking news.
And so, as a devout lesbian, I'm like, okay, you're my friend. That's how it is. I'm not looking for nothing. She's just like, hey, Gail, how's it going? Not even in the, how you guys are with married women, right? And long story short, her relationship's falling apart. She's married to a fellow who doesn't want to do his marriage vows or whatever. And she starts, hey, Kelly, hey, you're my best friend. How about this? I'm like, smat. This isn't going to work. And yet she persisted.
It was more like this.
Yeah.
Straight woman, stay away from me.
And she persisted, and finally I caved. Yeah. And no turning back.
Right. And the first date was where?
Where? It was in a parking lot in a car.
How romantic.
Right. I've been saying to Trevor, we are no different than anyone else.
That
all right?
was the first kiss.
Was it a Pontiac or a
That was
Buick?
her first kiss. It wasn't the first date.
Well, we had been out to dinner at the medical society,
Right.
right? And so is what do you do when you're colleagues. You go to the medical society dinners.
We
And
were
then she-
business partners by that time too.
Oh, you were?
We owned a practice together.
Oh, it's getting deep now.
Okay.
Yeah.
Wait, and was that at the Miracle Center parking lot, or was
No. It was
okay.
at El Torino's or Tortillos.
Tornino's.
Tornino's, not
Couple
El.
margaritas.
Italian. It was Italian
There
restaurant.
must have been some wine involved.
What kind of car was it?
Chevy Blazers
Chevy Blazer, of course, right?
in Fresno.
And it was black. It was black with camel interior.
Oh, baby!
One of my favorite cars ever.
That is
Yeah, it was
so
great.
awesome. What a great story. See, this is why we bring the spouses. I'm telling you, we get the dirt. It's
Yeah.
important stuff.
A
And
Chevy Blazer with a camel interior.
Yeah.
10 years dating, you said? And
Oh
then-
no.
Okay.
10 years as friends.
Okay, 10 years of friends.
I was married to a man for 25 years.
Mhm.
Yep. And
And
then
then-
that marriage ended, and then one day realized I was in love with this woman.
Good for you.
Never really had any inkling that I could love a woman before then.
Right.
Wow.
Yeah.
Giant improvement in your life. And how were your kids? Were they cool?
Sure, yeah. They were young, so especially the younger kids, and living in Fresno, it was a little hard for them to.
But
have
it
to,
wasn't
like-
hard for long because one of the moms at their school transitioned. And they said, the heat is off us because everybody's dealing with Ronnie's mom, who's now Ronnie's mom, dad, and the heat was off us.
Yeah, so you just at that point you just blended in and it
We
was
were
all
like
cool.
We were only-
At that point
Right.
in Fresno.
Right.
Well, that's amazing. So the kids never, because I know times have changed. Everything's so open and everything's, I think, better than it's ever been. But Fresno during that era, you know, it might have been a little tough on the kids.
Well, yeah, and I was going through divorce court and custody, and my now ex's attorney was planning to bring this to court and have custody. He wanted to completely remove me from the parental picture,
Wow.
and it was a matter. He was trying to get more money because then that would have meant more child support for my ex.
That's not the way it works here.
But fortunately, my
we
ex
worked it out.
is a good guy who understands parenting and co-parenting
Right.
and values,
Right.
and he wouldn't go for that.
Yeah.
Yeah.
Well, that's good to hear that it worked out okay.
Yeah.
Because I can see that being really a tear it apart family situation.
Yeah. Fortunately, we also had grandparents right in the neighborhood, and so the kids were surrounded by grandparents,
Who were
aunts and uncles.
affirming of our relationship and affirming of everything. So
That's
Was there
awesome.
anybody who wasn't affirming to it? Was there backlash? As far, maybe at work or
My
anything?
church.
Your church.
Yeah.
Yeah.
Yeah, so my kids said, "Mom, you got dismembered by the church," and it's
It sounds like they cut your head off.
Yeah, it felt like that. It felt like that. It
Those
was.
other churches.
It was the church that I spent all my life in. It was like my extended family. My parents helped found the church. We were attending.
and I told you this was going to happen.
Yeah, she told me. I didn't believe it. I came into this whole thing with 25 years experience of heterosexual privilege, and I didn't know what we're getting ourselves into.
Interesting looking back now on that, I bet, because how people treat you differently. It's so
Yeah.
unique.
Oh, and in the medical community too. Like, because as a woman married to a man, I was already a little bit of a threat in Fresno in the medical community.
Right.
But then when I married a woman, it became a huge scandal. Yeah. Well, yeah, we ended up. That's part of the reason we moved here. Yeah, we call ourselves Central Valley refugees.
Well, and luckily Santa Cruz is so welcoming. And,
Yeah.
Oh, yeah.
It's like such a great community. when
Yeah,
it
there's a
comes to-
lot of uppity lesbians here, so we feel right at home.
That's awesome.
Yeah, we're just like, I think when we moved here, there were 3 other OBGYN couples of women. So we were the 4th, so just a dime a dozen.
Yeah.
That's great.
You got this wallpaper.
And,
Yeah, right.
And how long? I mean, is there you're currently both, doctors. How long until you decide you're going to do the next thing? Is there a plan you've made?
Well, I already left clinical medicine, so that was a hard transition, a hard decision to make, to actually stop delivering babies, stop doing surgery, because once you do that, there's no going back. And so to become a health officer, you become a full-time administrator.
Right.
Yeah.
And so you hang that up. So it's a whole nother career, so to speak, for me. Kelli just gave up OB in April when she turned 60.
Oh, okay.
So now she's
I know, I don't look that old, huh?
No.
So,
That's
but that
awesome.
means for the first time in over 30 years for each of us, no nights, weekends, or holidays going into the hospital and catching babies.
That's almost half a retirement right there.
Right.
Right?
Yeah. Wow. Well, congrats to that. And what's like my question being is Maui in your guys' future? Is it going to be, you know?
Oh, we love Santa Cruz. We're staying here.
Yeah.
Staying here.
Absolutely.
That's
Yeah.
great to hear. That's
Yeah.
awesome. And you want to keep doing this for a while, being the health officer of Santa Cruz County?
I have to say I'm a little tired after the last 2 years of the pandemic, and I don't have a retirement date set for sure, but I turned 65 July of 2022.
What?
And I know.
You're kidding.
More breaking news, Neil.
I thought you were going to turn 64, and I thought it was 2023.
Your time card is going to be here in the boardroom.
Oh, right on.
Yeah, we'll have a big
you,
party.
thank
Yeah,
you.
no problem. So there is retirement in the future for you, then, you're saying?
Well, maybe I'm kind of hoping that there's work for me part-time. Once I decide to do that, maybe as a deputy health officer or
Consulting,
yeah.
using your expertise and experience.
Mhm.
Wow, that's
Okay,
so
I
awesome.
asked Kelli,
Yeah.
during COVID, when COVID first started and she had no idea what was going on, those first couple months, what was the darkest day for you guys? You know, you guys at the house up there in Passy.
Yeah.
What was the darkest day? Because there was a lot of backlash, as we all know.
Well, I kind of took my lead from Gail about, personally, how afraid should we be? You know, are we going to get sick? For our community, how bad is it going to be in the hospitals? Are we going to be overwhelmed like New York City? Neither of us were very. I mean, you get afraid of people when they're at our house, but we were not about to let that rule our lives. I mean,
Right.
so many people in Santa Cruz County did the right thing. So many things went right that it wasn't frightening. And they were just hippies that hopped the fence and they were singing it with a
the
ukulele.
protesters at our
But
house.
they were there all the time. They came. And then when you hear about the bad things that were happening to the other health officers around the country and in our state, that got a little scary.
Yeah.
Well, and also the when Sergeant Gutzweiler was
Yeah.
murdered,
Yeah.
and knowing that same group had also targeted the Santa Clara County health officer and our director here, our HSA director, that was really frightening to know that the same thing could happen. That
Yeah.
really it was those right-wing extremist groups that were the most worrisome and
I
continue
bet.
to be.
I mean, I feel for you and your position and some of the people in this community and how they responded to your decisions, because you made some very big decisions that affected people's livelihoods, and I imagine that some people probably got upset. Now, I feel the last time you were on the show,
him and I broke all your rules too. we put a band on the roof.
we did put a band on the roof.
You
Yeah,
did.
we did. Yeah, that didn't.
I heard about that at the time. Yeah.
Yeah, it didn't go over really well. We had a sheriff walk right through the door. So, but we.
Well, you didn't know that live music would make people dance in the streets,
I'd be
right?
happy for 5 seconds.
Yeah, we did. We had less than 10 people, so we were trying at that time. I think that it was 10 people. Was a group. I think am I wrong on that? Is it?
Yeah, but that's
Yeah.
okay.
So we had.
You tried.
Was I wrong? Okay, we thought 10 was a good number. I mean, we still got busted.
Right, and that was during the time when we didn't know as much.
No.
If you did that today, if we were in the midst of a pandemic and you did that today, you wouldn't get in as much trouble.
Right.
I think that you'd asked me about the darkest day,
Yeah.
and so many things happened politically with the Black Lives Matter marches, and of course the killing of that wonderful deputy, and then the elections. You know, I think Gail just kept carrying on with everything, but I think that those events, when there were 2 or 3 things going on at the same time, that's when it got a little frightening. When you had like the insurrection and COVID, when you had all the people marching in the streets and COVID, Gail would come home and say, oh gosh, I hope everything's going to be okay. I hope everything's going to be okay. And I'm like, well, you know, it's a petri dish. We'll learn something from it.
Yeah.
I did go join the Black Lives Matter marches myself. I felt really
She's
strongly
checking
about
it out.
that.
You were checking it out to
But
make sure
I
everybody
also-
had a mask on.
No. No, I wanted to be there.
Yeah.
Support.
Support, yeah.
It was interesting how they there was people there that really wanted to support the cause, and then there was people who just wanted to go and mess stuff up. You know, it's like it's really funny the two people that go to those events, and I felt like Santa Cruz got off relatively well in the scape of the damages that could have occurred when you look at some of the other cities in the country.
Yeah, the marches I participated in, folks were wonderful. They were respectful of each other. They would put their masks on when they were close together outside. They were generally outside, you know, not indoor events. And people were really respectful of each other.
I agree.
I'm so proud of our community through this whole thing. You know, we've done so well, and it shows in the results.
You know, I'm proud too as a business owner because I really didn't have to shake down too many people to wear a mask. And I thought it was going to be much worse. You know, we had that Rodriguez guy trying to mess up our town. And I just felt like...
He was at our house, too.
Oh, I bet.
Yeah, I talked to him for 20 minutes. Not once did he ask me who I was.
Really?
Yeah.
Interesting.
I couldn't stop myself. So
But
I said,
I didn't see a lot of that, which I was really happy with. Our community, I felt like, really circled the wagons and tried to help each other. It was good.
We have a healthy community here. I think people want to stay healthy.
Right.
You know, people want to stay healthy.
And they really care about their neighbors.
Yeah.
I mean, they're healthy not only physically, but also social, emotionally. And part of that is because they have compassion and caring for the people around them.
And so you could have been in communities where that would be much more of a struggle to be a
Fresno.
health officer.
Yeah.
Oh, yeah. So in Fresno, I actually wanted to be health officer there. And the opportunity arose, and instead of doing what was legal and ethical and doing an open recruitment, they just slid in somebody who was already there. Never has there been a female health official in Fresno. Not a director and not a health officer.
Right.
Yeah, much less a lesbian health officer.
Good move coming to Santa Cruz.
Yeah.
We're glad we got you.
Thank you.
you're a lesbian.
A lesbian.
I thought you were queer.
Yeah, yeah,
That
yeah.
shitty place that was hauled
No.
out of town.
That is
We gotta
amazing.
get the fuck out of here.
Yeah.
I know we didn't want to talk about COVID, and it's come up a few times in our conversations, but one thing I did want to ask you is that you were saying that you predict just a little bit of a growth during the winter months, and I was curious earlier when you said that, what would cause that?
Yeah, so I think we will see, my prediction is, and we'll see if this comes true, but I think we're going to start to see a little surge right now, and I think it's going to extend until about March, but it's going to be what I call blunt, so instead of that big sharp peak curve like we had last winter, it's going to be just a little, not even a wave, what do you call it, a swell. It's going to be a swell.
Yeah, better than a surge.
Yeah, better than a surge. And it'll be because we have a high vaccination rate here, and people are generally compliant with masking and staying home when they're sick. But we also want to gather for the holidays. We're moving indoors more because of the weather. And so I think we're going to see, that swell happen. And a lot of the cases will be vaccinated people. And so we're not going to see a lot of hospitalizations or deaths, but we will see more cases.
And then one more thing I wanted to ask you. The FDA, I saw or heard, just approved a new medicine that can help you recover quickly. Right? Is that the latest? It's not a vaccination.
I think it's in trials.
Oh, is it in
Clinical
trials?
trials,
Okay.
yeah.
But it seems to have pretty good
There's
success.
a lot of hope there. Yeah.
That's
Get my booster shot tomorrow.
Good job, Neil.
Yep.
Are booster shots really important?
Booster shots are important, especially for people who got J&J and Pfizer.
That's me.
Yeah. So if you got Moderna, You
Yeah.
you got the right one. You got the winner.
Winner.
Ding,
Okay.
ding, ding.
That's
Yep.
the winner.
All right. That's good.
And the Moderna's holding up the best.
And what made it? It means it's lasting the longest.
It's lasting the longest with the highest levels of immunity.
Are people getting the booster shot because the other one's wearing out, it's wearing thin?
Right.
Yeah?
Yeah. And at least that's true in some studies. But, there's other people who would say, oh, we're being greedy,
Right.
that we should be sending those vaccines to the southern hemisphere, places that haven't had the opportunity to even get a first dose yet. But there's pretty good evidence that those of us who got Pfizer and J&J should be getting boosted 6 months after.
So if I got J&J, would it be good for me to get a Moderna booster?
Yeah, if you got J&J, you get your choice of any of the 3
Oh,
for boosters.
really? Okay.
Yeah,
So
really.
should I swing for Moderna? Is that good advice?
That's
Not
what,
that I would take it. I just.
That's what I would do.
Is that good? Okay.
Yeah, I would boost with Moderna. And because the Moderna and Pfizer work a little bit different, in a different way than the J&J, so you're going to get like a combo that way of covering you in 2 different ways.
Oh, that's awesome.
Yeah.
What are you gonna get?
I'm getting a donut tomorrow morning.
Winner.
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 I was actually thinking about. I was listening to a phone the radio station today. You know, all those people who call in about
Yeah.
the vaccine and then
Yeah.
just why you should, the anti-vaxxers. It's unbelievable.
Yeah.
It's just
No,
what
yeah.
people, what people's minds work and why you shouldn't be getting a vaccine. I don't know.
When they're
already-
I fully vaccinated. I had plenty of vaccines when I was a kid, when I was born, right? This, that, and the other. I got scars right here. I
Right,
forgot
the
what the heck-
smallpox leaves that scar that you have. Yeah. But I want to speak a little bit about on behalf of the anti-vaxxers. Or
Okay.
not the anti-vaxxers, but vaccine choice, right? I mean, part of the reason we live in this country is for freedom. All the freedoms that we have about what we put in our bodies, how we get treated, what we say, what we believe in. I mean, that you can even do this show yourself, even outside of FCC regulation, right? And say what you want and how we feel on the air.
True.
What a huge freedom that
True.
is. That
Very
just
true.
doesn't happen in a lot of the rest of the world. And that's why we live in this country. And so I really respect people's choice
Not a girl.
to
But
make.
you shouldn't lie about it.
Well,
You should say you're not vaccinated,
well,
especially if
You
you
mean
play
Brett Favre,
football.
that guy, the quarterback,
Yeah.
right?
Not Brett Favre.
No, it was
Aaron
Brett-
Rodgers.
Aaron
Aaron
Rodgers.
Rodgers. Yeah.
That guy.
No, I agree. I think Aaron Rodgers should be penalized
For lying.
for lying, of
Yeah.
course, because he's an example for millions of people who respect and look up to him.
Yeah.
I feel like people in positions like that, of course, should be held accountable. And
So if you make a choice to,
Yep.
because we do have a choice, then you have to
be honest about it.
Yeah, you have to be honest about it and wear a mask and maybe not
Do the right thing.
That's a big
spit on
statement
people
by you, Gail. It's
in a
huge
huddle.
statement by you.
no, I think that's really
Yeah,
awesome
because-
because it's true.
Yeah.
But I also agree that you shouldn't lie about it if you're in a situation that you either have to have a vaccine or not. There's a coffee shop around the corner, and the owner said, "If you're not vaccinated, you can't work for me." And I guess that you can say that now. I guess.
You can.
Yeah. And so the whole staff cleared out.
That's right.
Yeah. Yeah. They all said on the 1st of this month, he brought in a whole new crew, and I was really surprised by that.
Do you still go there?
I have a friend who refuses to go there, but I went there today and got a cup of coffee. And but it's an interesting dynamic in today's world. I'm sure you're seeing.
Well, and now to keep your job, a lot of jobs, to be able to go to school, you got to get a vaccine. So some of that is that choice is harder and harder to make. So President Biden, new federal laws that go into effect, I think January 4th, you have to have your first vaccine in your arm by then. Mandatory vaccination for federal employees or once a week testing. And that covers 84 million federal employees, another 18 million mandatory vaccine that work for entities that receive Medicare or Medicaid funding.
84 million
healthcare-
employees for the federal government.
Yeah, that's a
84
lot,
million.
huh?
No. 84 million employees in the sorry, the federal government says any employer with 100 or more
Okay,
employees.
gotcha.
Yeah.
That's 84
And
million.
that's
I was like,
84 million.
That's
Yeah.
a quarter of our country.
Yeah.
Wow,
Yeah,
that's
there are a lot of people working for the government.
absolutely.
But not 84
What
million.
percentage of people getting vaccinated in Santa Cruz County? Do we know?
Oh, it's very high in
Is
Santa
it?
Cruz County, yeah. We're at about 75% of our total population now has gotten at least one dose. We'd like to see, once these vaccines roll out for kids, we'd like to see 80% or more fully vaccinated. That's the goal. That's
Wow.
what we think we have to do for herd immunity.
And is there an estimate when herd immunity happens?
We don't know, and there's different definitions of herd immunity, but and also there's some people who are immune by virtue of a previous infection, at least for 6 months, and so you count them in. So a lot of the southeastern United States is showing really good immunity right now
Florida,
from previous
right?
infections.
Yeah, exactly.
Texas,
Yeah.
yeah,
Florida
some of
is
the
doing
lowest
great.
transmission rates are in those Texas through Florida, that southeast swath, and that's because so much of the population has had a COVID infection in the last 6 months, so they're still immune.
But in 6 months, maybe we could spike again, right? If they,
6 months, that immunity starts to wear off. Yeah. Same
I have a
with
daughter-in-law
the-
who tested positive twice in less than 6 months,
Yeah.
which I thought was pretty amazing. So hopefully, if a herd immunity comes up and lasts longer than 6 months.
Yeah. But most likely, and here we are talking COVID still, but most likely this is going to be a virus we live with for our lifetimes, like we do with flu, but with greater consequences.
I mean, I go through my life now. Don't even think about it. Do you really?
No.
Too much?
Yeah.
Oh, I gotta go put a mask. I'm gonna go to the I gotta go to the grocery store. I'm gonna put a mask on. But really, don't think about it too much.
I do.
Do you do?
That's her job to worry
my
about
job.
this.
Good job.
But I do wear a mask all the time still. You know,
Good.
when I go into stores and when I'm in a anywhere I shop, anywhere, you know, it's I think important still, and I do it out of respect for other people more than myself.
Right, and I've really enjoyed not even getting a cold. Right, the last I mean, I haven't been sick at all since I've been wearing a mask,
No.
and that's pretty nice.
Yeah.
Yeah.
Some people predict we're going to start talking about mask season. You know,
Mask season.
mask season starts about, early October maybe, mid-October, and goes until the weather gets warm again. So, and maybe we just do that every year now,
Wow.
help avoid flu and colds and.
I want to circle
COVID.
back. We're going back to the very beginning of the show. I want to
Yeah.
talk about your honeymoon.
Yeah.
Oh, the
Uh-huh.
honeymoon.
Was it hot?
It was Fiji.
Okay,
Yeah,
well,
which island?
okay.
Fiji.
Nandi.
You went to
Well,
Nandi? That's
no.
the
We went to
capital.
Nandi, and then we went to
Savu Savu.
Savu Savu, and they had a Jean-Michel Cousteau all-inclusive scuba diving resort,
Nice.
and they had little berets. That's the name of their
Yeah,
little.
little
So we had our
little
own
huts on the water.
little huts. It wasn't on the water, but we had our own beret, and
We got scuba certified
scuba
there.
certified.
Awesome.
Yeah.
So there was diving and diving. Yeah.
Double diving!
Double diving.
Sounds like a great honeymoon.
Yeah.
Well, that was the hot part I was talking about.
Yeah, yeah.
PG.
Right.
It was really hot in Fiji, let me tell you what.
It was great.
Well, that is awesome. And have you guys gone on a big trip since? Has there been another
Oh,
second
yeah.
honeymoon?
Well, at our 10-year anniversary, when we went back to the same resort and
Oh, really?
took the kids.
Took the
More diving?
kids
Yeah, more diving. But the kids were there, so
Yeah.
no double
in our
diving.
beret.
Okay,
Yeah,
so
double diving.
there was a lot of
It's a
snorkeling
family.
and scuba diving. on that
That's
one.
right.
Yeah.
That's right.
And we did get married twice and had 2 honeymoons because then we had a legal wedding.
Gotcha.
Did
So
you do 3 weddings?
No, 2.
Just 2?
Where did we go on
Well,
a second
the
honeymoon?
2 of us just had 2 weddings.
Did we have a second honeymoon?
Just Yosemite and
Oh,
yeah.
okay, yeah. Really?
She
Oh, no,
forgot that
no.
one.
I did.
Yeah.
I don't think
Double
we had
check.
a second
No.
honeymoon. We need a second
We
honeymoon.
need a second
Yeah.
honeymoon.
And
Yeah.
which of the 2 weddings do you celebrate as an anniversary?
They're
They're-
the same week. They're a couple days apart.
3 days apart.
Oh, okay.
So we celebrate all week.
Great.
Yeah.
Yeah.
Yeah. Awesome. And have you been doing scuba stuff? Is that your deal?
We haven't, pandemic kind of a lot of that, but we have a trip planned in June that we might go to a place called Cendrawasih Bay
In Indonesia.
in Indonesia.
It's
Nice.
the birthing grounds of whale sharks
Oh, they're
in
massive.
far
Yeah.
eastern Indonesia, right next to
Papua New Guinea.
Papua New Guinea.
Yeah.
That
Very
sounds
cool.
amazing. That's
Yeah.
June of next year?
July.
Yeah.
July? That's fantastic.
July.
Yeah.
Uh-huh.
Huh. That's awesome. You ever scuba dive before, Neil?
That hurts my ears.
Me too. Yeah.
Not good.
No, we have surfers
By the way,
here.
Yeah.
You see Dr. Hetzler?
Something
You
new
know
with
Dr.
Hetzler?
I do.
Dr.
Yeah.
Hetzler's a sweetheart.
Okay, he and I were on the OR softball team together.
Oh, you were?
And he can hit too.
He can
Really?
He's a skinny little
He's
bastard.
a skinny little bastard, but he can hit. He can hit.
He is skinny.
Yeah. No, when he operates, he has his watch set, and every 15 minutes he gets up and he does exercises, stretches, and then he sits his thing for 15 minutes and gets
We got
back on it.
scoop, we got
Yeah.
His scoop on the dock. I love that.
And he'll have any of us come in and he's like, Kelly, come in, let me show you. And he's sitting under his microscope. He has his own little tools that he's made
All this
for
shit.
What kind of
surfers.
surgeon?
Ear.
Surface
Surfers' ears. People come from all over the world to have him chip little.
Yeah,
it's
yeah.
like
He's the
picking
man.
little. Oh, it's gross, but he's it's on. He's looking in the
What's
screen.
in there,
but-
Sam?
In my glove box in my car, I got the
Sand.
bone. I got the bone in my car.
Yeah,
It's
they
it's
get
all
like
red and chipped away.
Yeah, they
It's-
get like
Yeah.
a callus and all this creepy
You need
shit.
to go
And
see.
I know.
diatoms and
Dr.
planktons
Hessler.
and waxy
So,
buildup and all that.
I'm
Yeah,
watching football last night, and I never
Yeah.
watch football. Right? I'm sitting there watching.
because you thought it
Well,
was Brett Favre and not Aaron
Yeah.
Rodgers.
I watched that game
Football
last night.
game, right?
American
Did you see the
football.
Dr. Hetzler commercial?
No, there was a Dr. Hetzler commercial
He's
during
on
the game?
3 times. Oh yeah, I said, hell yeah. Looking tall and sharp and
Wow.
surface ear surgeon with son of surgery.
Is
I
he not?
texted-
Is he the sponsor for your show now?
No.
I texted him. I go, dude, you look pretty good. You look pretty handsome on the big screen.
Did he
Yeah.
reply?
No, yes, he did.
No, you need to get him and his wife.
I'm trying to get to Mississippi.
Oh,
yes.
So
Yes.
he comes here every year, once a
Yeah,
year.
yeah, yeah.
He brings his otoscope.
His wife's a plastic surgeon.
I know, hand
Yeah.
surgeon, right?
No.
Oh,
Yes.
the busy
We
part.
need some plastic
Yeah.
surgery.
We
Yeah,
do.
Exactly.
Well, you know, the
Look at
doc,
her.
Hessler's been on the show twice.
Yeah.
Twice he's looked at my ears and took me straight to his office after the show.
Right.
Because he's like, we got to take, and he pulls out like this cockroach has been in my ear, you know? It's insane. Yeah. Nicest guy on the planet.
Yep.
Good to see he can
Yeah.
hit. How's his glove? Is he good on the glove?
He's all right.
And where'd he play on the field usually?
He was like the left fielder.
Oh, really?
Yeah.
Okay.
Oh,
Huh.
see if you got screwed.
Yeah, okay.
It was really harsh, though. You know, we'd go out there and we'd play. We're all just old, has-been athletes. And by Monday, we're all just nursing our wounds. We lost 3 players in one game, like the hammy, you know?
Yeah.
Oh, it's terrible.
The stretchers.
Yeah. It was
We had a show
terrible.
one night. We had a show one night, and I couldn't hear a thing. It was in hot yoga, water's in my ear. I can't hear anything. I'm reading lips, right? And I called. I got an email, doctor. You gotta do. I know it's 6 months to see you, but you gotta do something. I got a show tonight. I can't hear a freaking thing.
Yeah.
He goes. He's calling me. Call him up. He goes. I go, hey doc. He goes, can you help me? Can you help me? He goes, I want you to be here at noon. Okay. With what? Go down the street, the 41st Avenue. Get me a foot long. Ham, cheese, pickles, mayo, mustard, and be here at noon.
Yeah.
So I'm walking there at noon, like plastic with my bag,
Yeah.
sandwich. The guy goes,
Yeah.
"Gee."
Oh,
Well,
I'm
the
not
type
to
of guy
do
he is.
that.
We've had people come down. He does free ear surface ear checks, and he takes TC and then whoever else up to his
Right on.
office, and
Yep.
he's just a good
He's
guy.
great. Yeah,
Yeah.
he's been a great guy.
Are there any surfing gynecologic issues that people need help with?
You know, that's a great question.
Yeah.
And I don't know about
Because
that.
I probably can't check them on the street or anything, but you know, I could talk
I mean,
to
I
them
don't
about
know.
it.
I think the red tide would be an
Yes.
interesting situation
Yeah,
because
yeah.
I mean not that red tide, but the actual red tide in the ocean.
Yeah,
But
yeah.
because you can get sick and get ear infections and nose infections, and I think anything that's open.
I haven't really heard that.
Yeah, so maybe
Yeah.
not.
Nah, probably.
Well, we heard about it when we lived in Fresno.
Yeah, a lot of ladies on the lake.
Yeah.
You know,
Mm.
they get not so fresh. We called it lake pussy.
Uh-huh.
See, Neil, we had to have Kelly on the show just for that.
Told you. And it could be
We've had almost 600 shows and no one's ever said the 2 words lake pussy.
pussy, lake pussy.
That just gets a little sour from the lake water. I
Yeah, a
guess.
little sour.
Okay.
Yeah,
Like-
and it's especially if like you're on a houseboat for a few days.
Yeah, it gets
and-
old.
You can't.
Yeah,
Yeah, it gets
and-
old
and-
and musty. It's
Musty.
Yeah, you change the flora and fauna in your vagina.
Gotcha.
Yeah,
Is that kind of like a yeast infection type situation? for-
Fauna.
flora.
Okay.
Yeah.
I was gonna say like
Yeah,
Bambi.
You don't want like
No.
baby fish,
Baby
Flora.
fish.
Lorna.
Yeah.
and also
Fresh water. You need fresh water.
also water ski injuries.
Really?
Yeah, we've seen some of
A
that.
big,
A big,
a
big,
big
oh,
Rip
giant
in the
gush of
labia.
water.
Oh,
yeah.
got it.
Uh-huh.
From hitting, like sitting down and getting the water.
Yeah.
Oh, boy.
That's like a powerful bidet.
Yes.
Yeah.
Mhm.
Right?
Yes.
Yeah.
So wear wetsuits when you water ski. Don't
No,
wear the bikini.
no.
Well, you just got don't fall.
Don't fall that
Don't
direction.
fall on your vagina.
I think you guys should make some kind of like lesbian video for sports.
Yes,
You know,
yes.
right?
How to protect the.
How to protect the parts.
The bits and
ladies.
pieces.
Like it only happens on lesbians?
I don't-
Like a
maybe-
lot
no,
of
no,
people
you're right.
water ski.
They are very
Good move,
athletic.
Neil. She's never coming back now.
They're very athletic.
Yeah.
Right.
That's and have you written books? Written anything? You had thesis papers that have been published famously.
I have some scientific articles about preterm birth, but not about leg
That's gonna
pussy.
be real humdinger.
Yeah.
Just
That's when I got scared. That was the darkest moment.
you had to read that.
I'm like,
That
I
is
don't
awesome.
understand this.
Well, I gotta say, Neil,
Yeah.
I love having these people on the
Yeah.
show. You know,
We
Gail and
get
Kelli,
blessed.
thank you.
We're blessed to have
Yeah.
people just come and talk.
Right on.
Can we talk a little bit more about COVID?
Absolutely.
Well,
You said you didn't want
I
to,
know.
but bring it on.
I know.
Your first
This
words
is what
were,
I do
"Oh,
to
Yeah,
my
I
mom."
got that.
Okay, but let's talk about how people can be safer at the holidays.
I love that.
Yeah.
Okay, so I know you guys said you don't think about COVID anymore. You're not really doing it much
Well,
different.
it's not on the forefront. I'm not saying
Right.
don't think about it anymore.
Yeah.
It's not on the forefront of your mind. I gotta
Yeah.
go wash everything. I gotta clean
So
everything.
I just want to encourage people to think about who's gathering around your Thanksgiving table, for example. And, especially if people have been traveling to get there, they come from high COVID risk communities, like you got relatives coming from the Sacramento area or Central Valley, Fresno, yep.
Into our county.
Into our,
Into
or
our
other
clean
states,
county.
into our relatively good county.
Did you say Clean County?
Our clean county.
Mm,
Yeah.
I like that.
But then you're talking about dealing with families.
Yeah.
Well, so
That's right,
we're not
right?
saying don't have them, but I'm saying,
But-
maybe do some of those at-home tests. So we're trying to
Right.
promote testing before turkey. So test before turkey. So before you sit down together and take your masks off, do an at-home test. Consider that. No one should come if they're feeling sick with symptoms that might be COVID. You really got to stay home then.
How about
you
an
know.
unvaccinated family member?
Yeah, you got to think about that too. You are at greater risk. Everyone's at greater risk in the room if there's someone unvaccinated there. But most families have at least one unvaccinated person.
Right.
But
And
if they
the kids,
test-
some of them can't get vaccinated
Right.
yet. The under fives. Yeah, but if you test with an at-home test, it's pretty good. And you can feel fairly safe about gathering then.
I've taken multiple at-home tests. They're very easy.
Yeah.
Yeah, it's a very simple product.
And the CDC says now that those are really pretty much as good as the PCR testing. So the gold
Wow.
standard.
Okay, so be careful of the holidays.
Yep.
Yeah.
And I think where you travel, I recently had family who traveled to Eastern Oregon. They got sick,
Yeah.
in a very low vaccinated area, and people that places they went to, there was no COVID there in their minds.
I have to laugh. One thing, I have a blood clot in my leg. Okay, so when we mentioned it on the air, I must have gotten 20 emails. Oh, you got that blood clot from the vaccine. We know it's from the vaccine. It's from the vaccine. I'm like, no, I had one 15 years ago. And blood clot 15 years ago wasn't because of the vaccine. It's amazing what people have, how people chime in and they're so anti. But again, once again, as you said, it's a
Free
choice.
country.
Right? It's a choice.
Happy that Gavin Newsom made an appearance today, so we know that he's okay.
Is he all right?
Yep.
I heard he was on Guantanamo. That's what I heard. I heard on the radio the other day. They took him away. They
was
shipped him
he?
off to
He
Guantanamo.
was hiding.
No one had seen him in public for 11 days.
Uh-huh.
And so there was people were, and he'd gotten a booster toward the beginning of that. So people were saying, "Oh, well, he got so sick from the booster that he hasn't been able to be out and around." But I heard he was in Monterey County today, did an appearance there, and that he's fine. There's pictures of him in the background of a wedding.
Yeah.
So
Yeah.
I'm glad.
Fresh laundry.
Well, yeah,
Yeah.
it's important for leadership. And how was how would you rate his leadership during this whole thing? Because you obviously were working with other state officials.
Overall, I'm very supportive of what he's done. I think he opened up too soon in the summer of 2020, and it sent us into a surge. I probably would have done things a little more cautiously. If people remember, he opened tourism widely, even when some businesses were still shut down locally. So that probably wasn't the right move. But that's in hindsight, and I'm not in his shoes.
I personally thought Santa Cruz was gonna just be the hotbed because I have a business that's kind of tourist based. They came from everywhere. We were on the radar because they couldn't get on airplanes and they
Right.
couldn't go to their favorite destinations. They loaded up the van and drove to Santa Cruz. And I get credit cards and we check IDs. They came from everywhere.
Right.
It was incredible. And I'm really impressed that it didn't get worse.
Yeah, well,
Well,
most of the activity was outdoors because that was summer, and they came for outdoor activity. I hate to bring up the beach closures, but I think they did discourage people coming from out of town to our beaches.
Yeah.
For sure.
And
And it dodged the homeless for somehow. So God knows how it dodged the homeless, but it just.
knock on wood for
Right.
homeless. I lose sleep over homeless populations and the jail, the inmates in the jail, because those groups, they don't have a choice
Right.
about where they live and how they live and who they're exposed to.
Right.
And with the weather changing, have we seen any uptick with homelessness as they start to pack into, tarp
With
enclosures?
cases,
Yeah,
nope. Mm-mm.
that's amazing.
It is.
I would have thought in the beginning of all this they would have really been in a high infection rates.
Well, we housed about half of our homeless population in hotels. So hoteling, those hotels and motels that were empty when the
Right.
tourists weren't coming. The county made long-term contracts with many of those to house persons experiencing homelessness. So that helped a lot.
I bet those hotels were happy.
Yeah, and we also have an isolation quarantine hotel in Watsonville, many rooms with a place for people to go, homeless people to go when they get exposed to COVID or when they get infected themselves.
Yeah.
Was the homeless population infection rate lower than the rest of the county?
It was about the same.
About the same? Okay.
Yep.
Well, I'm glad
Yeah,
to
And jail, so far at least we've dodged a bullet. No outbreaks at all in the jail, and credit there goes to the sheriff's office.
Right.
They've worked with us in public health so well, following all the protocols and procedures to prevent outbreaks there. So, really grateful for their partnership.
As a county, Santa Cruz, where would we be? Are we in the top 10% of counties in California?
Oh yeah, we're one of the best vaccinated with the lowest death rate. One of the lowest death rates in the state.
Very, very few deaths, isn't there, lately? Isn't it one you mentioned one at TC? Was the
There was
other?
one, I think, yesterday, maybe? In the day before? I thought I saw it in the Sentinel.
Very, very few
Yeah.
in the last few months. Yeah.
That must make you feel good, as being our health director, to have
It does.
such a. I mean, I won't call it a success story, but it's very nice to see that we are at the top.
Yeah. And again, the credit though goes to our community. Really, people's willingness to think beyond themselves and do the right thing for the people around them.
Well, congratulations.
Yeah.
for,
Thank you.
for steering the ship.
We want you back on the show when you're not Santa Cruz Health Director. We don't think we're just dragging your ass down here because that's who you are. We want you to come back because you guys are a hoot.
Yeah.
You guys are a fantastic couple, and
Thank you.
Yes.
You're part of Santa Cruz and its makeup, and we want you here. We don't give a shit what you are. You can go.
Yeah, right.
We're
pick up
uppity
cars.
lesbians.
Yeah, well, it's great because we
We're
told you
lesbians.
last time, we're like, we need Kelly down here.
Yeah.
We need to
We're
get
lesbians too.
I was
There
like,
you
we
are.
got to get to the dirt. So,
Yeah.
and thanks for sharing some good dirt today.
Yeah, you're very
we
welcome.
loved it. Yeah, that was
Yeah.
awesome.
She
Yeah.
See, this is just a little test drive right here.
Yeah.
Let's do a whole show on surfing gynecology.
No, that's
Yeah.
awesome. That is
sure.
great.
We'll do that in the future.
Yeah.
The medical field around here is unbelievable. I mean, I got this blood clot, and then the doctors have been, it's amazing. They're really good. Really good.
Yep.
Yeah, let me put a plug in for my docs. You know, the doctors, I think that they had to take on a role that they were not used to doing. They had to be people's sisters, brothers, mothers, kids, to hold people's hands. To, you know, when it's really sad that family couldn't come in, but it was really hard on our doctors and nurses that had to do a lot of that. It took a lot out of them. And it's something that they're really not going to get much credit for and acknowledge. So if you see anybody that had to treat a lot of people, you know, treat them with kindness and thank them for that.
Yeah, absolutely.
It's an incredible thing that they had to do.
Yeah.
Yeah.
Yeah, that must have been so hard to hold somebody's hand in the last moments of their life, knowing their family couldn't be there. You know.
Brutal.
Yeah, I have a 94-year-old mom in a assisted living situation, and I couldn't see her for so long. We just waved out the window, you know.
Yeah.
It was a trying time for families.
Yeah.
And you're right, the health
It was hard
community.
for them too. Yeah.
Well,
Thanks, guys.
Yeah.
How was the show? Bad? Right? Was it okay?
Loved it, as
C+.
always. Super fun to be here.
well,
Was it really?
thank you so much for coming
Yeah.
in, Kelly. Thanks for
Yeah,
coming.
you're
I
welcome.
really
Thanks, guys.
appreciate it.
Yeah.
Stick around for the photo.
Yeah,
op.
and I
Okay.
also want to thank you for just working so hard during such a difficult time, having people shake your fence at your house and scream at you.
But you also part of that was TC is like I knew, you did. I knew we had good leadership. Like
We did have good
Even though I
leadership.
forgot about COVID, I'm driving around going, "Fuck it." You know what? I got a good leader. She's gonna tell me what I
That's
need to do.
nice.
I need to wear a mask, not wear a mask, whatever. We have good leaders in this town.
Right,
We
and
do.
and I was one of the only health officers who had the support of my electeds, so my supervisors, the city councils, and my county administrative officer and my sheriff.
That's awesome.
Most health officers were at odds with their law enforcement, so I'm really, really grateful for all of that partnership.
That's awesome. Well, again, thank you, because I feel like you saved lives. You know, so thank you for that.
Thanks.
She's gonna come
Yeah,
back next
yeah.
week. She's gonna come back next time as an employee of the